I think that COVID-19 allowed for the edges of individuals to start to see how our public health infrastructure can really, if not in place, impact us all, right? And the things I would say specifically around using data to advance health equity and what we've learned through the pandemic is really, we need to use data to understand where disparities exist and what those disparities are, whether those are social. I think people have been very comfortable thinking about social determinants of health. I think COVID and other emerging diseases have moved us past that to more political, environmental, and economic determinants of health. How we use data to direct our efforts and our resources to address those disparities, to impact spread, how we can measure progress towards achieving our greater equity goals, and how we can actually have accountability